I finally have some good news for breast cancer patients, so keep watching this. If you have breast cancer, a family history of breast cancer, you've had breast cancer in the past, or if your breast cancer was estrogen positive, then you can have topical vaginal estrogen. Let me show you the receipts or the data to share with your healthcare professional or your breast cancer team. Topical vaginal estrogen is used for genitourinary syndrome, the menopause, or what we used to call vaginal atrophy, and for pelvic health. This picture on the video, please save it and have a look, because it's not just a bit of vaginal dryness. You get vaginal symptoms, you get sexual symptoms, and urinary symptoms as well. And for all of this, low-dose topical vaginal estrogen is really helpful. And the data now shows that low-dose topical vaginal estrogen can use as a preventative and as a treatment for all of these symptoms, which for so many women is debilitating and just absolutely barbaric that we leave women with these symptoms. Here are the 2024 NICE guidance for those with breast cancer. So the guidelines clearly state now, consider vaginal estrogen for people with a personal history of breast cancer and genitourinary syndrome. And even though they've tried vaginal lubrications, it's okay. For people receiving adjuvant aromatase inhibitor treatment for breast cancer, it's safe as well. Vaginal estrogen may also be used in combination with non-hormonal moisturizer or lubricant. As always, when assessing the safety of vaginal estrogen for someone in relation to breast cancer, you must take into their personal risk of reoccurrence as well. And there's clear guidelines on what would be considered as low risk or high risk. And this in the NICE guidelines for people with a personal history of estrogen receptor negative breast cancer, recognize that estrogen systemically absorbed from topical vaginal estrogen is unlikely to increase the risk of reoccurrence of breast cancer. So it's safe, 2024. And the guidelines go on that for people with a personal history of estrogen receptor positive breast cancer, it's unknown. We're not too sure whether it can increase the risk of reoccurrence of breast cancer, although I'll show you some more data which does show that it doesn't increase the risk of reoccurrence, but also that estrogen receptor blocker medicines such as tamoxifen actually negates the risk of breast cancer reoccurrence when using topical vaginal estrogen. So I come bearing even further receipts. Have a look at this article. So patients who've had tamoxifen for their estrogen positive breast cancer, they can still have topical vaginal estrogen. Another article to show a patient on aromatase inhibitors will need to speak with their oncologist, but the data shows that they can have DHEA vaginal estrogen such as Intrarosa or Parastone. If you need further data that vaginal estrogen is safe for breast cancer patients, look at this. And only in November 2023, I have further data to back up the fact that taking topical vaginal estrogen with breast cancer or in breast cancer patients is safe. It does not increase the risk of reoccurrence. I hope that's given you a lot of confidence to take that to your healthcare professionals, your oncologists and your breast cancer teams. And I completely get it. Getting a diagnosis of breast cancer is life-changing, it's horrific, and it can be debilitating for you, your family and your loved ones. However, we cannot leave women with genitourinary syndrome of the menopause or vaginal atrophy without treatment. I think that is equally barbaric. So before using vaginal estrogens, think about lubricants. So I would recommend Yes or Sutil, something that doesn't have glycerin in it. Please have an informed discussion with your breast cancer team or oncologist about the benefits and the risks, and take these studies that I put in this videos, which I'll tag along as well in the bottom in the captions, and make an informed decision between you and your team. I hope this video has been useful. Please leave any comments down below and I'll try and answer as many questions as possible.